Insulin is a critical, often life-saving treatment for millions of people with diabetes in America. But unpredictable costs can present challenges to the people who need it most. The Medicare Part D senior savings model can help. Among people with Medicare, 1 in every 3 has diabetes, and more than 3.3 million use one or more of the common forms of insulin. For some of these people, access to insulin is a critical part of managing their health. Gaps in access to insulin can increase the risk of serious complications, ranging from vision loss to kidney failure, to foot ulcers, to heart attacks.
For 7 million Americans who are living with diabetes, insulin is the life-saving drug that they need in order to thrive. It's incredibly important that they be able to afford this insulin.
Most people with Medicare have coverage for insulin through their Medicare Part D prescription drug coverage. However, based on the way Part D is structured, what someone pays out of pocket for insulin can change from one month to the next. This unpredictability in costs can become a barrier to effectively managing diabetes. In March 2020, the Medicare Part D senior savings model was announced to address President Trump's promise to lower prescription drug costs.
It's going to make such a difference to the lives of many seniors across the country. And I am optimistic that this could be a model to lower the cost of many other drugs in the Medicare program.
This model will provide Medicare patients with new choices of Medicare Part D prescription drug plans that offer insulin at an affordable and predictable cost. In these plans, a 30-day supply of a broad set of insulins on the plan's formulary will cost no more than $35. This means that people with Medicare could save an average of $446 per year.
The reduction in prices and costs of insulin would benefit me and many, many other Americans to be able to have a few niceties in life. Would allow me the privilege of making extra trips to the beauty shop, extra clothes that I love, trips with friends out to eat, and the little extras that you can't afford if you have to pay that for insulin.
I pay more for insulin than I pay for property tax. I order through the mail because that's the cheapest, least expensive, 90-day supply. But as soon as I order it, I'd immediately go into the donut hole. And there I go for the next 2 times, and then I come out at the end of catastrophic. But by that time, I'm out of pocket. It's over $6,000. And now I'll be out of pocket, $35 a month max. That's real money. That is real money.
There is significant interest from sponsors offering Part D plans and participating in the Medicare Senior Savings Model. This means that America's seniors across the nation will have access to more affordable insulin drugs. People with Medicare will be able to find and compare the Part D plans that offer this coverage on Medicare.gov during the fall open enrollment period, which begins on October 15, 2020. The new coverage will begin on January 1, 2021. Medicare is dedicated to providing increased access and more affordable prices for the prescription drugs that America's seniors need most.